In this video, we are going to discuss GuidedSMILE Natural, which is our Chrome FP1 design, as opposed to FP3, FP2. This is an FP1 crown and bridge type of design for the prosthesis. And generally, this type of case is designed when you have a patient who's young and elevating and removing a lot of bone is not necessary or ideal, or perhaps the patient has some good architecture in the anterior or hopefully in the posterior as well, and that there are other reasons besides overall dentition failure or bone failure that the patient's going through this procedure. So normally a gummy smile is not a reason. It is usually a contraindication for an FP1 because it's very difficult to reproduce a patient's natural gummy smile, especially over the long term. Interdental papilla, interdental bone, tough to maintain, not impossible as we see, as we've seen quite a bit of, but it's very difficult and it's a little risky. But the patient's young, so we are going to make FP1 for this doctor. So the records for these cases are standard Chrome cases, upper, lower STL files or impressions, all land areas, CT scan with the teeth separated, and then some nice series of photographs. Right, we want to see a big exaggerated smile, natural smile. Profile not quite as important. These pictures, we don't need them, but I was showing them just to see the patient's current condition. If a patient has an existing implant, we'll have to deal with that. But this is just a maxillary FP1 case, and you can see quite a bit of dental history for a young patient. So with that, we went through the normal process of wax up, meeting the doctor, planning the case, and then shipping it off. And in this case, because there's so many roots, doctors want to do some extractions prior to pinning the pin guide. All right, so let's get started since this is really a surgical series. Labial flap is reflected. Really need to do this on a lot of FP1 cases, need to expose the bone so that you can make judgment on where to adjust. Some of that can be predetermined, but a lot of it is also based on how the extractions go, how good the buccal plate is, etc. during surgery. So labial flap is exposed. And in this case, the implant was removed, refining tool to remove the implant, and then extractions or sectioning of any bridges to extract the teeth so that the pin guide can be seated. And then just simply follow the instructions on the iPad on the surgery mat for removing the teeth, and the roots, and then the pin guide is inserted. And this is standard procedure here. Seat the pin guide, make sure it fits, doesn't rock, make sure all the tissue is out of the way. Here's a Minnesota, making sure the tissue is apical to the fixation base, and then just simply follow the rules or follow the program on the surgery mat. So in this case, the patient has short, all short pins. All right, so 4 short pins, and then just as normal, someone on the staff, the team is holding the pin guide firmly against the teeth, seated, and then the doctor will go through the protocol of pinning. Here we go. 4 short pins are in. And then just confirm that nothing moved. You'll look in the windows here and make sure the teeth are fully seated. All right, and the chrome locks release the pin guide. And then the next step is to dance a little. This is a Nobel guided kit. All right, and the next thing the doctor will do is go through the process of extractions. And obviously, young patient, good roots, so it was quite a bit of effort to do all these extractions. Right, a lot of teamwork. So this was pretty tedious for a doctor to complete. All right, once extractions are completed, then you can look up at the surgery mat, make sure that the fixation base looks like it's in the proper position, right, floating. Just make a quick visual, kind of helps just to make sure nothing moved during extractions. You know, if the fixation base is going to have any issues, it would be during the extraction of all these teeth and all that work it took. So just make a quick verification. All right, and then make a lingual flap. Not too much, just a quick lingual flap, just to get it out of the way, so the tissue is not affecting how the prosthesis is seating, or if you have to make any bone adjustments. And then what you'll do is use the prosthesis to verify where the bone is to be reduced, right? You can either use a scallop guide, but sometimes a scallop guide it's very tricky to design if the scalloping of the bone is really close to the fixation base. It's tough to fit a scallop guide in here. There are ways to elevate this fixation base apically to make room for it, but in this case, the doctor is just going to use
down there.
Just going to use the prosthesis to idealize, right? So we've got a little bit of rock. Just got to determine where the bone is being held up.
Yep, on the distal of 9, the lingual. I'm sorry.
You want to take that down a little bit?
Yep.
Yeah. Okay. So we'll do quite a bit of back and forth until the prosthesis seats, and then make a determination if more bone needs to be reduced to make space for biology, for tissue and so forth between the prosthesis and the bone. Right. So once it seats passively, a little bit of adjustment here and there until it's passive. Right. Use some indicator.
You tell me,
A lot of it is just visual.
But you still got to see it because you see the buckle defect.
Talking about a buckle defect.
And whenever you want to remove from the top there, you just let me
Just a little more adjustment, and then it was good. You can see here a little more adjustment needed, and then finally until it was seated, and then you proceed with osteotomy guide. Right, you can make a visual here of it seated. You can also confirm where the angles are on this image. You can also confirm the angles on each of the SurgiMat implant sites. Right, here's an angle here. It's also repeated on the part that goes on the bench or on the counter, the SurgiMat. And this will also give you implant size, which drill to use, overall drill depth, and then RP, NP in this case for a Nobel, regular platform, narrow platform. All right, so just about everything you need to know about the plan is on the SurgiMat. All right, then the next process is to just go through drilling and placing the implants. And with FP1, with natural, the implants are placed very subcrestal. We have rules for that. We'll discuss that during the online meeting. One of the nice things about the Nobel kit is that you can have multiple drivers, mounts, and you can leave them in the osteotomy guide if you wish to stabilize the osteotomy guide. Kind of a nice little trick. especially when you have lots of angles. This particular case, in this case, it's 2 30s and 4 17s. So a lot of care has to be taken into driving these implants and making sure the depth and rotation is perfect to make sure the temp cylinders are in the right spot. So this a lot of care is taken at this point. And then one thing is a little different about Nobel, between Nobel and others, is that the mount in the active is not perfectly engaged in the sleeve. They leave some wiggle room here, some space, so that the surgeon can feel the bone. The doctor will line up the inside of the mount to the inside of the sleeve visually, as opposed to it being fully controlled. Kind of a little different approach to guiding. But most of these keyless systems will have a real intimate fit. But either way, so a lot of care taken to make sure that the depth and rotation is perfect. And then when you get down to the very last turn, you're going to line up the dot and the nub, which you can see right there. Dot and the nub are lined up. And just verifying some depth measurements for the top of the implant.
That's well.
And then a little bit of a bone profiling tool was used. Nobel has kind of a neat one. You just put a stem on the implant and then just take the profiling tool right over it and down. Quite easy to use, easy to verify. Here's another post going in and then doing another profiling. Because these abutments are deep and angled, they all are going to require profiling to make sure that they're totally down. Nice driver that the doctor uses, contra angle driver. All right, so now implants are in, bone has been sculpted, prosthesis fits passively. It's looking good. Multi abutments are in. And again, there's a visual up on the SurgiMat where you can make sure that the rotation, that the angle of the copings, which these are handles, but those are in the same trajectory as the copings. Make sure they're in the right position, which they look very good. I was on site for this surgery. And then the multi-unit abutments, make sure that, well, they're already in, but this is where you would verify the angles per site. They're all numbered on the SurgiMat. All right, temp cylinders are placed. Then the gaskets are sleeved over. Now this is an FP1, so there's no carrier guide because the carrier guide will not fit because there's bone there. So just seat the prosthesis right over the sleeves. Make sure the gaskets are in place, and then you would just come in and just carefully backfill the well, not the wells,
As long as
the
I have the
holes.
block out, I can squirt away, correct?
Yes. Yeah, I mean, it's not the same as sitting on a carrier guide. You know, I would still keep the tip, you know, halfway in there.
I should cure those too.
You know, your kids can, if you got kids, your kids can run around and do what they want.
So here's where you'll put the tip in about halfway. Don't put it all the way in like you might if there's a carrier guide. Put it halfway in. Fill the well. Fill the hole so that you get hopefully a 360 all the way around the temp cylinder. Hit it with a light, and really should not be any issue at all to pick these up. There you go. Right. This was a C2F case. So we went through the whole protocol of C2F, which you can see on the website. There are good videos showing this process. But what that means is that we're going to use the rapid appliance and we're going to deliver it to the model, add analogs, add copings back in the lab to the model, and then pick them up in the take-home prosthesis that has no holes. And then we'll drill through, okay, to make small holes, and then do a little bit of curing. And then we have this beautiful prosthesis, right, with very small holes. So this prosthesis is going to be very strong. It has metal reinforcement, has small holes, looking good, and then deliver it about 45 minutes later. That is another Chrome FP1 surgery.